All right, everyone, welcome back. Today we're taking a deep dive into cholesterol management.
Oh, an important one.
Yeah, for sure.
Literally close to everyone's heart.
Exactly. And to guide us through this topic, we've got this fantastic presentation by Dr. Khalid Hassan.
He's a clinical pharmacology expert.
Yes, packed with insights on, how to keep those cholesterol levels in check.
And it's so interesting that high cholesterol, it's kind of a silent culprit.
Right.
A lot of people, they don't even realize they have it until it's, causing bigger problems.
Yeah, it sneaks up on you, right?
Yeah.
So let's start with the basics.
Okay.
What exactly is cholesterol and, why should we even care about it?
Yeah, so cholesterol, it's a fatty substance,
Yeah.
and our bodies need it to function properly.
Okay.
Building cell walls, it helps produce hormones, making vitamin D.
So it's not all bad.
No, not at all.
Like most things in life, it's about the balance.
Exactly. Too much of a good thing can be bad news.
Right. Moderation is key.
Yeah, definitely.
So then when do things start to go wrong with our cholesterol levels? What happens?
Well, that's when we start talking about dyslipidemia.
Dyslipidemia.
Which is basically an imbalance of lipids, including cholesterol, in the bloodstream.
Okay.
It's kind of like, if you think about it, like a traffic jam in your arteries.
Oh, a traffic jam.
Yeah. And over
Oh.
time, that can lead to plaque buildup, which is, a condition called atherosclerosis.
Atherosclerosis. Okay, that sounds serious.
Yeah. And that's where, things can get a little scary.
Why is that so concerning?
Atherosclerosis. It's really like a ticking time bomb for your cardiovascular system.
Oh, wow.
As plaque builds up in your arteries, it narrows them, and that, restricts blood flow, and that increases your risk of serious conditions like coronary artery disease, stroke, even peripheral artery disease.
So it's not just about the numbers on a blood test.
Right.
It can have really significant consequences.
Yeah, exactly. It's about, preventing these potentially life-altering events.
Yeah, for sure.
And, to really illustrate how serious high cholesterol can be, Dr. Hassan starts with this case study
Okay.
about a young boy, just 4.5 years old, and he's diagnosed with something called homozygous familial hypercholesterolemia.
Homozygous familial hypercholesterolemia.
That's a mouthful, but it's basically
What is?
a rare genetic condition that causes really high cholesterol levels right from birth.
Oh, what? Right from birth?
Yeah, so imagine, you're a little kid and you're already facing this serious health challenge that most adults, don't even think about.
Right. They don't even have on their radar.
Yeah.
So that's really powerful.
Yeah.
So how do we even know if our cholesterol levels are too high?
Well, that's where a lipid profile comes in.
Okay.
It's a simple blood test that measures the different types of cholesterol in your blood.
Okay.
So you've got your total cholesterol, LDL cholesterol, that's the bad kind, HDL cholesterol, the good kind,
Okay.
and then triglycerides.
Okay. So a few different players in this game.
Yeah, definitely.
And why are those different types important?
So, the ideal ranges can vary depending on your individual risk factors.
Right.
But in general, you want your total cholesterol below 200 milligrams per deciliter.
Okay.
When it comes to LDL cholesterol, lower is better.
Okay.
Ideally, below 100 milligrams per deciliter, even lower if you're at higher risk.
Got it.
Yeah.
So LDL is the one we really need to keep our eye on.
LDL, yeah. Think of it as the troublemaker.
Okay, the troublemaker.
These particles, they carry cholesterol through your bloodstream,
Right.
and they can deposit it in your artery walls, which contributes to that plaque buildup we talked about.
Ah, I see. So it's directly contributing to that atherosclerosis.
Exactly.
So what about HDL? Why is that the good cholesterol?
HDL is like the cleanup crew.
Okay.
It acts as a scavenger, picking up excess cholesterol from your arteries,
Right.
transporting it back to your liver
Right.
to be processed and removed.
Okay.
So having higher levels of HDL is actually protective against heart disease.
So it's kind of like a balancing act between the good and the bad.
Yeah, exactly.
There's not just one number we're looking at.
No, it's not just total cholesterol.
Right, right.
You've got to look at the whole picture.
Okay, that makes sense.
And, Dr. Hassan really spends a good chunk of this presentation explaining how LDL cholesterol actually contributes to the formation of those atherosclerotic plaques.
Yeah, let's break that down.
Yeah.
How does that work?
Okay, so imagine the inner lining of your arteries.
Right.
That's called the endothelium. Think of it as a smooth, delicate surface.
Okay.
Now, various factors like high blood pressure, smoking, diabetes, even just aging
Okay.
can cause tiny injuries to this surface.
So like little cracks in the wall.
That's a great analogy. And guess who loves to slip into those cracks?
Uh-oh, I have a bad feeling about this.
LDL cholesterol.
So troublemaker.
That's right. Once those LDL particles get into the artery wall, they can become oxidized.
Oxidized.
Which means they become damaged and even more harmful. So it's like they go from mischievous teenagers to full-blown delinquents.
Okay.
Now your body tries to fight back, sending in immune cells called macrophages to try and clean up the mess.
Okay.
These macrophages, they engulf those oxidized LDL particles.
Right.
But in the process, they become engorged with cholesterol and they turn into foam cells.
So even the good guys get, corrupted by the bad cholesterol.
In a way, yeah.
Yeah.
And these foam cells, they accumulate, forming fatty streaks,
Okay.
which are the early stages of plaque buildup.
So like the beginning of that blockage.
Exactly.
Yeah.
Over time, as more and more LDL particles get trapped, the plaque grows and it hardens, narrowing the artery and restricting blood flow.
It's like this slow motion blockage happening in our arteries.
Yeah, and we might not even know it's happening.
Right. That's the scary part.
Yeah.
Now, we've talked about the LDL being the bad guy, the HDL being the good guy.
Right.
But what about the liver? Where does that fit into this whole picture?
The liver is like the central processing unit for cholesterol. It produces cholesterol, helps remove it from the body, and it regulates those cholesterol levels in the bloodstream.
Okay, so it's a pretty important player.
Absolutely. And one of the key ways the liver regulates cholesterol is through LDL receptors.
LDL receptors. Okay, now we're getting technical.
A little bit, but it's not that complicated.
All right, I'm ready.
So think of LDL receptors as gatekeepers on the surface of liver cells.
Okay.
Their job is to bind to LDL cholesterol in the bloodstream
Right.
and escort it into the liver cells where it can be processed and removed.
Okay.
So the more LDL receptors you have, the more efficiently your liver can clear that LDL cholesterol from your blood.
Okay, so more gatekeepers, good situation.
Exactly. But there's a catch.
There's always a catch.
When there's already a lot of cholesterol inside the liver cells, they start producing fewer LDL receptors.
Wait, so the more cholesterol we have, the less effective our body is at removing it.
Yeah, it's kind of a vicious cycle.
It's a bummer.
Yeah, unfortunately.
So that's where those therapeutic lifestyle changes come into play. The TLCs.
Exactly.
Yeah.
Those TLCs, they're all about making healthy choices that can help lower that LDL cholesterol
Okay.
and raise your HDL cholesterol.
Right.
So things like adopting a heart-healthy diet, getting regular physical activity, maintaining a healthy weight.
Okay, all good things.
Yeah.
But, real talk, those things can be tough to actually do, especially in our busy lives.
Right. It takes effort.
So are they really enough?
They can have a significant impact, especially when combined with other strategies.
Right.
But for some people, lifestyle changes alone, they might not be enough.
Okay.
Especially if their cholesterol levels are really high or they have other risk factors for heart disease.
Got it.
That's when we start talking about medication.
Okay, so let's talk about those medications.
Okay.
Now, Dr. Hassan goes into like a whole world of pharmacological therapies for managing dyslipidemia.
Oh.
And he lists, a bunch of different types.
Sure.
We've got statins, bile acid sequestrants, niacin, fibric acid derivatives.
It's like alphabet soup.
It is. Cholesterol absorption inhibitors, fish oils, and even these, newer agents.
It can be a bit overwhelming at first.
Yeah.
But each medication, it has its own, unique way of tackling the cholesterol problem.
Okay.
And it's important to remember, it's not one size fits all.
Right.
The best medication or combination of medications is going to depend on your individual situation.
So working closely with a doctor is really important here.
Absolutely.
Figure out what's best for you.
Yeah, shared decision making.
Okay, so before we jump into all those different medications, just to recap what we've learned so far.
Okay.
So we know that high cholesterol, particularly that LDL, can lead to the buildup of plaque in our arteries.
Right, and that's atherosclerosis.
Atherosclerosis, and we know that that increases our risk of those serious cardiovascular problems.
Heart attacks, strokes, peripheral artery disease.
Yeah, the big ones.
Yeah.
And we've also talked about HDL.
The good guy.
The good guy, the cleanup crew,
Yeah.
and how the liver plays a crucial role in regulating cholesterol levels.
Especially through those gatekeepers, the LDL receptors.
The LDL receptors, yeah. So we've got a good foundation.
Yeah.
Now let's dive into the world of these cholesterol-lowering medications.
Yeah, all right, let's do it.
Starting with the, I think, most well-known and widely prescribed, the statins.
Statins, the heavy hitters.
Yeah. Okay, so tell us about statins.
All right. So statins, they're often the go-to medication for lowering LDL cholesterol.
Okay.
And they work by blocking an enzyme called HMG-CoA reductase, which is essential for cholesterol production.
So they're basically like putting the brakes on the liver's cholesterol factory.
Yeah, that's a good way to think about it. By inhibiting this enzyme, statins can really reduce how much cholesterol your liver makes.
Makes sense.
Yeah.
Now, Dr. Hassan mentions that statins are particularly effective. Like, they can lower LDL cholesterol by like 30 to 50%.
Yeah, it's pretty significant.
That's huge. But are there any downsides to these, cholesterol-busting powerhouses?
Well, like any medication, statins can have potential side effects.
Right.
The most common ones are muscle-related, so things like muscle pain, weakness, or tenderness.
Yeah, I've heard people say that, like, statins make their muscles ache.
Yeah.
Is that, like, a common concern?
It's true that some people experience muscle discomfort while taking statins.
Okay.
But it's important to remember that most people tolerate them well.
Okay.
And the benefits often outweigh the risks.
Okay, so it's something to, keep in mind, but not necessarily a deal breaker.
Right. Talk to your doctor,
Yeah, exactly.
if you're having issues.
Yeah, for sure.
Now, Dr. Hassan also points out that statins can sometimes affect liver function.
Okay, how serious is that?
Usually, it's pretty mild and reversible.
Okay.
Regularly monitoring your liver enzymes through blood tests is usually enough to catch any potential problems early on.
So it's not something to be, like, overly worried about.
Right.
But it's good to be aware.
Yeah, just something to keep an eye on.
For sure, for sure.
And something I find interesting is that statins are typically taken in the evening.
Oh, really?
Yeah.
Is there a reason for that? Is it like a vampire thing?
No, not quite. It actually has to do with your body's natural cholesterol production cycle.
Okay.
Cholesterol synthesis kind of ramps up during the night.
Oh, interesting.
So taking a statin in the evening helps to maximize its effectiveness.
So it's all about timing.
Yeah.
Strike when the cholesterol factory is working overtime.
Exactly. And, another important point is that Dr. Hassan emphasizes that statins are contraindicated during pregnancy.
So that means they're not safe to use during pregnancy, right?
That's correct.
Okay.
Statins can cross the placenta and potentially harm the developing fetus.
So that's a really important consideration for, women who are pregnant or planning to become pregnant.
Yeah, absolutely.
To talk to their doctors about that.
Definitely. And, it's a good reminder that any medication, even those that are considered generally safe, right, should be discussed with your doctor, especially during pregnancy.
For sure.
And, another thing to keep in mind is that not all statins are created equal.
Oh.
Dr. Hassan actually categorizes them into different intensity levels.
Okay.
Based on how much they lower LDL cholesterol.
So, like, some statins are more potent than others.
Exactly. So you've got your high-intensity statins.
Okay.
They can lower LDL cholesterol by 50% or more.
Wow, that's a lot.
Yeah. Then you've got moderate-intensity statins.
Okay.
They lower LDL cholesterol by 30 to less than 50%.
Got it.
And then you've got low-intensity statins,
Okay.
which lower it by less than 30%.
So how does a doctor decide, like, which intensity is right for a patient?
It really depends on a combination of factors, including the patient's baseline cholesterol levels,
Right.
their overall risk for cardiovascular disease,
Okay.
and, their tolerance for potential side effects.
So it's a very personalized decision.
Absolutely. It's all about finding that right balance between effectiveness and safety.
Makes sense.
Yeah, and Dr. Hassan does mention that there's some debate in the medical community about whether to start patients on a low dose and gradually increase it, or to go with a higher intensity statin right from the start.
So like two different schools of thought.
Yeah, there are definitely pros and cons to each approach.
Right. Yeah.
So the start low, go slow method, that can help minimize side effects.
Okay.
While the hit it hard approach aims to really get those cholesterol levels down quickly.
Right.
Especially in high-risk patients.
But I imagine those conversations between doctors and patients can be like pretty nuanced.
They can be, yeah.
When they're, trying to decide the best course of treatment.
It's important to have that open communication with your doctor.
Right.
To discuss your concerns and preferences.
Exactly. Shared decision making.
Yeah, absolutely.
Now, statins aside, Dr. Hassan talks about like a whole other arsenal of cholesterol-lowering medications.
Oh, yeah, there are a lot of options.
It can feel like a bit of an alphabet soup with all the different drug names.
Right.
So let's try to break that down a little bit, make it digestible for our listeners.
Sounds good. Let's do it.
Okay, so let's start with bile acid sequestrants.
Okay, bile acid sequestrants.
Those sound interesting.
They work in a kind of a unique way by binding to bile acids in your intestines.
Bile acids.
Yeah.
Okay, what are those?
So bile acids are actually made from cholesterol in your liver.
Okay.
And by preventing their reabsorption, these medications force the liver to use up more cholesterol to make new bile acids. Which ultimately lowers the amount of cholesterol circulating in your blood.
So it's like a clever, roundabout way of tackling the problem.
Exactly. And actually, Dr. Hassan brings up a case study here.
Oh, okay.
It's about a 66-year-old woman who's prescribed a medication that binds bile acids.
Okay.
He asks, which medication is the patient likely using?
Let's see if I can remember. There are a few different bile acid sequestrants, right?
There are, yeah.
Okay.
The most common ones are cholestyramine, cholestyramine, and cholecalciferol.
Okay, so which one's the most likely in this case?
Based on the information provided, the patient's most likely taking cholestyramine.
Okay.
It's one of the older bile acid sequestrants.
Got it.
And it's often used as a first-line treatment.
Okay, that makes sense.
All right, now moving on to another class of medications, the fibrates.
Fibrates, okay.
So these medications work by activating a type of receptor called PPAR-alpha.
PPAR-alpha, all right.
Which regulates genes that are involved in lipid metabolism.
Okay, so they're kind of like master switches.
Yeah.
Flipping on the genes that help control cholesterol.
Exactly. Fibrates are particularly good at lowering triglyceride levels.
Okay.
And raising HDL cholesterol.
So they're targeting a different part of that lipid profile.
That's right. On their own, they don't have as much of an impact on LDL cholesterol.
Okay.
But they can be used in combination with statins for a more comprehensive approach.
All right, so kind of like a team effort.
Yeah, working together.
Yeah.
Now, Dr. Hassan highlights two specific fibrates, gemfibrozil and fenofibrate.
Okay, are there key differences between those two?
They both work in pretty similar ways.
Okay.
But gemfibrozil is known to have more potential for drug interactions.
Okay.
So often, fenofibrate is preferred.
Okay, that makes sense.
Now, what about side effects? Are fibrates generally well tolerated?
Yeah, good question.
So the most common side effects are gastrointestinal issues.
Okay.
So things like nausea, stomach upset, diarrhea.
Okay.
There's also a potential for an increased risk of gallstones.
Okay, so not without its risks.
Right.
But for some people, those benefits might outweigh the concerns.
Exactly. And again, that's a decision best made in consultation with a doctor.
Right. Always talk to your doctor.
Always talk to your doctor.
Okay, now let's move on to another interesting medication. Niacin.
Niacin, okay.
Also known as nicotinic acid or vitamin B3.
That's right.
I think I've heard of that one.
Yeah.
That's the one that, makes you flush, right?
You got it. So niacin is remarkably effective at raising HDL cholesterol.
Okay.
Better than any other medication we've talked about.
Wow, really?
Yeah, and it also helps to lower triglycerides.
So it's a double whammy against those lipid imbalances.
Exactly. But, that flushing thing, it can be pretty unpleasant.
Yeah, that doesn't sound fun.
No, not really.
So what's that like?
So it's this sudden feeling of warmth, redness, and itching.
Okay.
Typically in your face and upper body.
Oh, man.
Yeah, not really the side effect you want.
No, not ideal.
And actually, Dr. Hassan has another case study about this.
Oh.
It's about a 59-year-old man who's taking niacin and experiencing that flushing.
Right.
The question is, what's the best way to manage this side effect?
That's a good question.
Yeah.
Is there a way to, prevent or reduce that flushing?
There actually is. Taking aspirin before taking niacin can help minimize the flushing.
Aspirin. Really?
Yeah.
Huh. I thought that was just for headaches.
Well, aspirin has anti-inflammatory properties.
Okay.
And it turns out flushing is an inflammatory response.
I see.
So taking aspirin beforehand, you're kind of preemptively addressing the inflammation.
That's a clever trick.
Yeah, it's a good one.
So even though niacin can be effective, that flushing thing might make it a less desirable option.
Right, for some people, yeah.
Yeah, for sure.
And, there are other potential side effects to consider with niacin.
Okay.
It can cause muscle problems, liver issues, gout flare-ups.
Okay.
And even raise blood sugar levels, which is a concern for people with diabetes.
Right. So it's definitely a medication that requires, careful consideration.
Definitely.
And monitoring.
Yeah.
Now, let's shift gears again and talk about cholesterol absorption inhibitors.
Okay.
Specifically, ezetimibe.
Ezetimibe.
That one sounds familiar?
Yeah.
How does that work?
So ezetimibe, it targets a protein in your small intestine.
Okay.
That's responsible for absorbing cholesterol from food. So by blocking this protein, it reduces the amount of cholesterol that enters your bloodstream.
So it's like cutting off the supply line at the source.
Exactly. And ezetimibe is often used as an add-on therapy to statins.
Okay.
To further lower those LDL cholesterol levels.
So like a 1-2 punch against cholesterol.
Yeah, that's a good way to put it.
Are there any downsides to ezetimibe?
It's generally well tolerated.
Okay.
The side effects are usually pretty mild.
Okay.
Most common complaints are gastrointestinal issues, diarrhea, stomach upset.
So not too bad compared to some of the others we've talked about.
Right, relatively speaking.
Now, before we move on to those newer agents that Dr. Hassan mentions,
Okay.
I'm curious about something. What about just good old-fashioned fish oil?
Oh, yeah, fish oil.
I've heard that can be beneficial for cholesterol.
Yeah, so fish oil, it's a rich source of omega-3 fatty acids,
Okay.
particularly EPA and DHA,
Right.
which have been shown to lower triglyceride levels and raise HDL cholesterol.
So all those salmon dinners might be doing more than just satisfying my taste buds.
Exactly. And there are also prescription-strength omega-3 fatty acid medications available for people with really high triglyceride levels.
Good to know. So are there any downsides to fish oil supplements?
The most common side effects are fishy burps and indigestion.
Oh, okay. I can see that happening.
Yeah.
Anything else?
Some people also experience an increased bleeding time.
Okay.
So it's important to talk to your doctor if you're taking blood thinners.
Right. That makes sense.
So, yeah, fish oil can be a helpful addition to a cholesterol management plan.
Okay.
But it's not without its considerations.
Right. Everything has its, pluses and minuses.
Exactly.
Now let's dive into those newer agents that Dr. Hassan mentions.
Okay, the newer stuff.
He starts with a case study about a 64-year-old woman with, a pretty complex medical history.
Okay. Sounds complicated.
Yeah, she's got high triglycerides and low HDL cholesterol. And she's already taking multiple medications, including rosuvastatin, which is a statin.
Right.
And Dr. Hassan asks, which medication would be the safest addition to her therapy?
So this is where things get a bit tricky.
Yeah.
Because you have to consider all those other medical conditions and potential drug interaction.
Right. It's like a puzzle where all the pieces have to fit just right.
Exactly. So based on the information provided, the safest option for this patient would probably be colesevelam.
Colesevelam.
One of those bile acid sequestrants we talked about earlier.
Okay, so why colesevelam specifically?
Well, other options like niacin and fibrates, those are kind of off the table because of her existing medications and the potential for interactions or complications.
Got it.
Vasepa, which is that prescription omega-3 fatty acid,
Right.
that's not suitable because she's got a seafood allergy.
Right.
And increasing her rosuvastatin dose, that's risky given her history of statin-induced muscle problems.
Okay, so it sounds like colesevelam is the best fit, considering all the factors involved.
Exactly. It's generally well tolerated, doesn't have any known interactions with her other medications.
Okay.
Plus, it can help lower triglycerides and raise HDL cholesterol.
Okay.
Which addresses her specific lipid imbalances.
Yeah, so it's really about personalized medicine,
Absolutely. Finding the right fit for each individual.
Right, when it comes to managing these, complex health conditions.
Yeah, for sure.
Now, Dr. Hassan then moves on to another category of newer medications, MTP inhibitors.
MTP inhibitors, okay.
What are those?
So those medications work by blocking a protein that's involved in the assembly and secretion of VLDL.
VLDL.
Which is kind of the precursor to LDL cholesterol.
So they're basically preventing that bad cholesterol from even being produced in the first place.
Exactly. They're targeting that production line right at the source.
Wow, that's impressive. Are those commonly prescribed?
Not as commonly as statins.
Right.
They're typically reserved for people with very high cholesterol levels that haven't responded well to other treatments.
Makes sense. So for more severe cases.
Yeah.
Now, Dr. Hassan also mentions another group, APO, B100 synthesis inhibitors.
Okay.
What can you tell us about those?
So those medications work by blocking the production of ApoB100,
Okay.
which is a protein that's essential for the formation of LDL cholesterol.
So they're like shutting down the assembly line for those bad cholesterol particles.
Yeah, that's a great analogy.
Okay.
And like those MTP inhibitors, they're typically used in those more severe cases where other treatments haven't worked.
Got it.
Now, there's one more class of newer medications that Dr. Hassan mentions, and these seem pretty exciting.
Okay, I'm intrigued.
PCSK9 inhibitors.
PCSK9 inhibitors.
These are kind of a game changer for a lot of people with high cholesterol.
What makes this so special?
PCSK9 inhibitors, they target a protein called PCSK9,
Okay.
which normally helps regulate the number of LDL receptors on liver cells.
Remember those LDL receptors, those gatekeepers we talked about?
Exactly. So
Yeah.
PCSK9 inhibitors, they actually increase the number of those gatekeepers,
Oh, I see.
allowing more LDL cholesterol to be cleared from the blood.
So they're like boosting the liver's ability to get rid of that bad cholesterol.
Yeah, that's a great way to put it.
Okay.
And studies have shown that PCSK9 inhibitors can dramatically lower LDL cholesterol levels, often by 50% or more.
Wow. That's a huge reduction.
It is, yeah.
Okay, so really powerful medication.
And remember that case study we talked about earlier, the young boy with homozygous familial hypercholesterolemia?
Oh, right. Yeah.
Who was already taking a statin, but still had very high cholesterol.
All right, right.
Well, in a case like that, where statins alone aren't enough, a PCSK9 inhibitor, like evolocumab, would be the most effective intervention.
Wow, it's amazing how medical science is always, coming up with new and better treatment
It really is.
for these challenging conditions.
Yeah, for sure.
Now, Dr. Hassan wraps up his presentation
Okay.
with just a simple thank you slide,
Nice.
reminding us it was prepared by himself. Dr. Khalid Hassan, professor of clinical pharmacology and clinical research at the University of Maryland Eastern Shore.
All right.
What an incredibly informative presentation.
It was a good one.
I feel like we've been on a whirlwind tour of, the cholesterol landscape.
Yeah.
We've covered everything from, the basic cholesterol metabolism to, the intricacies of these medications and treatment strategies.
It's a lot to take in, but hopefully, people are feeling more informed and empowered.
Yeah, exactly. Empowered to have, those conversations with their doctor about managing their cholesterol.
Exactly.
Now, before we wrap up this deep dive, I think it's worth just taking a moment to pause.
Yeah, let it all sink in.
Yeah, and really let all this amazing information, settle in.
Absolutely.
Welcome back, everyone. It's time to wrap up our cholesterol deep dive.
Yeah, we've covered a lot of ground.
We have. We've journeyed through the science of cholesterol,
Yeah.
Learned about its impact on our health, and explored this whole range of treatment options from, those simple lifestyle tweaks
Yeah.
to those cutting-edge medications.
It's been quite the deep dive, but hopefully everyone's feeling more informed
Yeah.
and ready to take charge of their heart health.
Absolutely. So as we kind of, wrap up this cholesterol adventure,
Okay.
what are the key takeaways you want our listeners to walk away with?
Well, first and foremost, knowledge is power.
Okay.
Knowing your cholesterol numbers and, what they mean, that's crucial.
So get those numbers checked.
Yeah.
And don't be afraid to ask your doctor questions.
Exactly. Advocate for yourself.
Yeah, for sure.
Then remember that healthy habits, that's your foundation.
Yeah.
Eating a heart-healthy diet, getting regular exercise, maintaining a healthy weight.
It's about those small, everyday choices
Yeah,
that add up over time.
exactly. Consistency is key.
Yeah, consistency for sure.
And then, if those lifestyle changes alone aren't enough, there's a whole arsenal of medications out there that can help lower cholesterol and reduce the risk of those heart problems.
Yeah, we've covered everything from statins to fibrates to those PCSK9 inhibitors.
It's a lot,
Yeah.
but each one has its own unique way of, tackling that cholesterol challenge.
And it's about working with your doctor.
Right, absolutely. That best treatment approach, it's not one size fits all.
Right.
It's about finding the strategy that's right for you.
It's a partnership, a collaboration.
Yeah, for sure.
Now, before we sign off, there's one thing I wanted to circle back to that Dr. Hassan mentions in his presentation, and that's managing dyslipidemia during pregnancy.
Oh, yeah, that's an important one.
Yeah, we haven't really touched on that yet.
Right.
So what are the key considerations there?
Well, pregnancy is a unique time,
Yeah.
and cholesterol levels naturally rise throughout gestation.
Okay.
But most of those cholesterol-lowering medications, they're not safe to use during pregnancy.
Right.
Because they can pose risks to the developing fetus.
So what are the options then for pregnant women with high cholesterol?
Well, the focus really shifts to those lifestyle modifications.
Okay.
So eating a healthy diet, getting regular exercise, managing weight inappropriately.
It sounds like a really delicate balancing act.
It is.
Weighing those risks and benefits carefully.
Yeah. And it's crucial for pregnant women with concerns about cholesterol
Right.
to have those open and honest discussions with their healthcare providers.
So shared decision-making is really important.
Absolutely, yeah.
Well, as we wrap up this deep dive,
Yeah.
I keep thinking back to that young boy in the case study, the one with that rare genetic condition.
Right, the one with extremely high cholesterol.
Yeah,
Yeah, it's a powerful reminder that high cholesterol can affect anyone at any age.
it really is.
And it really underscores the importance of early detection, prevention, and proactive management.
Yeah, it's never too early or too late to start taking care of your heart health.
That's a great point.
So, to our amazing listeners, thank you so much for joining us on this journey into the world of cholesterol.
It's been a pleasure.
We hope you found it informative, empowering,
Yeah,
maybe even a little bit inspiring.
hopefully.
Remember, taking control of your cholesterol, it's an investment in your future well-being.
It's a gift you give yourself.
Yeah.
A commitment to living a healthier, longer life.
Absolutely. So stay curious, stay informed, and stay heart healthy.
And until next time, happy diving.
Happy diving, everyone.